In this video, I'm going to share with you an extract of a coaching session in which I provide constructive feedback to a registrar on his communication and consultation skills.
Hi, this is Dr. Erwin, one of the doctors calling from the surgery. Can I just confirm patient's name and date of birth, please?
Mr. William. So his date of birth is 17th of February, 1954, and I'm his son, Craig.
All right. Hi, Craig. This is Dr. Farooq. How can I help you today?
Well, I'm quite worried about my dad's memory. He's been more forgetful lately. I've found that he's been having times when he's lost keys and he's actually not sure about various things. And he keeps asking me the same questions about when, like he asked me like, when is my mom going to come back? But actually my mom passed away a few years ago. So I'm not sure what's going on, and I'm just worried that he's losing his faculty. And then the other day he went to the shop at 11 o'clock night, and he went there to go and buy his papers, and he thought that it was during the day. So it's very out of his character. There were a few things as well that I've noticed in the house where he's left things and is not sure about various things where he left, and he's usually very organized. So that's why I thought I had to have a chat with you, because I'm quite worried whether he might have dementia.
Absolutely. Thank you very much for giving us the call today. Can I just ask you about this? Did it start all of a sudden, or was it gradually that you've seen your dad?
Well, it started about a week ago. It's actually been very rapid. A week ago, he was well. He was doing his own activities, whereas now I'm having to come by every day.
Okay, all right. And I gather that he lives on his own, because
That's
you
right, yeah.
sound quite concerned. Okay. I just need to ask you, has there been any safety concerns in your mind? Does he drive?
Well, he hasn't been driving.
Okay, he doesn't drive.
But the one time when actually he was at the shop, I was quite worried, because it was the neighbor who actually saw him and managed to get him back home. And then the following day, I learned about it.
Okay. And has the neighbor or yourself seen, does he cook? Are you concerned about, his safety in terms of using the knob?
Well, yeah, he's still cooking, but I haven't thought about it until now. Like, I haven't seen any hob left on or anything like that. But yeah, that's one of the things that he still carries on doing.
Mm-hmm. And so you said the symptoms started a week ago. Have you seen him have any fever, or has he been unwell in himself in any way?
No, he has not had any fever, but he has been complaining of dizziness. So about a month ago, he was seen by another GP who stopped one of the blood pressure medication.
Okay, all right. Now I can see that he has blood pressure, diabetes. Can I just ask you? I mean, you're obviously very concerned. You sound very concerned that he's went outside to the shop. Is there anything in particular that you had in mind that you wanted to speak to me about?
Yeah, I was worried whether he might have dementia.
Okay,
So
all right.
I was thinking whether we needed to get him checked for that.
Okay, and okay, so that's what you called me primarily. Is that correct?
Yeah.
Okay.
Yeah.
Is there anything else that you had in mind?
Not really. No, I
Okay.
mean, I think his diabetes is well controlled.
Okay.
Otherwise.
Okay, fine. And in terms of his depression, how about his mood? Is that well controlled? You told me that his wife passed away, so I mean, he's 68, lonely. Is there something around? Are you concerned about that?
I mean, his mood seems to be fine. I haven't noticed any issues with his mood, but he has been out of character lately.
Okay, all right. Okay, and in terms of his this might sound a bit sensitive, but has he have any living will or any of those matters discussed before?
No, I don't think he's got anything arranged.
Okay, all right. Well, thank you very much, Craig, for telling me today. I think I know that you're concerned about dementia, and this is definitely something that we need to look into. So I would like to offer you an appointment for you to bring your dad. How does that sound to you?
Yeah, I could bring him today.
Okay. Well, Craig, when you bring your dad in, I think it's important just because it's has such an acute, like just because it happened a week ago and it's all of a sudden, we just want to make sure that there's no infection or any other causes of his confusion.
Okay.
Yeah, so that would involve us taking his temperature, doing just listening to his chest, checking his urine to see if there's any infections. What are your thoughts?
Yeah, I mean, I think that's a good idea.
Do you think he'll be comfortable to come to the surgery?
Yeah, he'll be all right. Yeah.
I think it's also we'd also have to do a test for memory, if that's how does that sound?
Yeah, I mean, I think his memory is quite poor.
Okay, all right. So I think it's important, absolutely. I think it's important that we bring him in today, and we make sure that there are no signs of infection that he's actually experiencing, and then we'd have to we'll do the test for dementia. It is important if he does, and once we do the test, and if he does sounds like he is suffering from dementia, there are a few things that we can do.
Okay, yeah.
First of all, there are some non-pharmacologic treatments, so any treatments that does not involve taking medication, that would include some kind of a group therapy. It can also include a structured exercise program, and it would also include something like a stimulation program for people who have dementia. What are your thoughts?
Yeah, I mean, I'll go with what you say, doctor. So can I pose you here? Let me just pose you here to help you here. The thing here is that dementia is not a diagnosis, it's just a syndrome. All right. We need to think of a working diagnosis. And also here, you want to show you're making a safe assessment. So clue here is about this dizziness. So I'll give you the clue.
Okay, yeah.
Think about the box. This is a case where this patient is having ataxia, they're having problem with the control of the bladder, and also loss of memory. So have you got the working diagnosis? Can you think what it is?
Yeah.
Okay, right. So let's resume.
Okay, so Craig, I would like to bring your dad in because he's having dizziness and your bisoprolol was stopped, and you did say that he's not able to walk properly. So I'd like to bring him in today just to examine examine the nerves of his face, and examine the back of his eye, just to make sure that he doesn't have something causing a high pressure in his brain. What are your thoughts about that?
Yeah, I mean, I can bring him. Yeah, that's not a problem.
Absolutely. I think this is so if that is the case, then we'd have to speak to a specialist, and we'd have to go send him to a specialist today. Is that okay with you?
Yeah, yeah.
Do you have any questions?
So you mentioned pressure. What does that mean?
So sometimes so our brain is surrounded by fluid, by water, by fluid, to actually to keep the brain inside the skull. Sometimes there is a normal pressure of the fluid around the brain. So that sometimes can get high because of a blockage, and that can lead to side effects. And that can often present with symptoms like the ones that your dad is experiencing. I think it would be important to actually bring him in so that we can examine him, and then we'd probably need to send him to a specialist the same day.
Right.
It,
Okay.
how does that sound to you?
Yeah, that sounds good. So does that mean he'll stay in hospital?
Yeah, so it may require him to stay in hospitals to get the test done, and if that is the case, to actually manage it.
Right. Yeah, I think it's better if he stays in hospital because I don't think he's safe to carry on living on his own.
Absolutely.
And
So
I live quite far away.
okay, absolutely. When he goes to the hospital, I think once they find out the recent cause for his symptoms, they can also do some occupational therapy. So actually find out how, if he's capable of an independent living. They will also go home and actually make some adjustments in the house to make sure that he's safe to be at home.
Right. Okay. Yeah.
Do you have any questions for me?
What time can we come down?
Absolutely. Just come down now and we'll see you today.
Okay. Thank you, doctor. We'll come down now.
All right. Thank you.
Right. So what are your thoughts about this case?
I just went along the lines of I thought it was delirium, but then I wanted to speak about the management of dementia, even if it's acute, because I thought that's how I will cover the clinical management. I tried to stay in 6 minutes in terms of the history taking, and I had to do the ICE and the psychosocial, and my biggest concern was safety. So because I wanted to make sure that he's safe at home, because that's probably what I spent time in. So I saw the dizziness. I didn't go into the dizziness.
You want to try and keep things relevant, but sometimes what happens is when you have a entry recently, sometimes it could be linked, so you can't really just compartmentalize it. This case is quite complex because this is a third-party consultation. You're consulting son. I think it's worth inquiring whereabouts is a dad right now, and also asking as well, is a patient aware that the son is talking on his behalf today? Because when you're asking this question, it shows that you're thinking about confidentiality, you're thinking about whether the patient is still able to make decisions. This case here, you also want to know whether there's other problem in the faculty. So not just memory loss, also other things like when you're talking with your dad, is he able to answer questions? So things like that, just to kind of in a way assess via the telephone to see how bad is it. But the question that you asked were very focused. So you asked questions that showed like you're thinking about the safety of the patient, and you asked also about the patient's mood, how his patient's mood is. And yeah, delirium is definitely a diagnosis on top of the list here. When you are discussing the management, I think you could make it a little bit more patient-centered, because at this point it was very much doctor-centered. Like you were saying, I will send your dad to the hospital, you get a check there, and then about the explanation a little bit more simple as well. That would have helped. If you had to do it again in terms of the explanation, was there anything you would have done differently?
I say to the son, I am concerned, and you are right to be concerned as well. And I think it's appropriate to bring your father in. I'd like to offer an appointment for him to actually come into the surgery, if that's okay with you, and if that's okay with him. What we'd like to do is we'd like to do some basic observations, like checking temperature, like checking pulse, like blood pressure, to make sure, listening to his chest and his urine, to make sure that he doesn't have an infection that might be leading to him being confused. If that is not the case, then we would like to do some tests for checking his memory. Well, how does that sound to you? And if that's the case, then there are options that we can offer, like referral to the memory clinic. What are your thoughts about that?
It's better than the last one, but here I think it's worth verbalizing what's your working diagnosis. So your working diagnosis here was non-pressure hydrocephalus, right?
Yes.
You did kind of explain it, but I think it's worth highlighting that this is different from what the son is worried about. So by making that contrast, then you hone it down with the son. Does that make sense?
Yeah. I just didn't know what questions to ask to actually get to the definition of to get to the diagnosis of normal pressure hydrocephalus, and how would I ask about ataxia? Has he had any falls? Is he wobbly on his feet?
Yeah. So these are good questions to ask, because that will help you to gather evidence as to non-pressure hydrocephalus. Because you know the history of a short change in the patient's cognitive faculties is actually one of the clue. Because dementia is usually something that's insidious. It usually takes months to years to actually progress, whereas a short history of 1 week, it tells you there's something else could be going on. So in terms of the bladder, you could ask like, has there been any accident? Because sometimes they will have a problem with incontinence, which is unusual.
Yeah.
And also, in this case, you could actually speak with the patient as well, like see whether if the patient is with the dad, then say, could you put me on loudspeaker so that we can have a chat? So then you can ask a question. If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.